Hello, David Sherrill here, Dublin Physiotherapy Clinic. Most people who attend for physiotherapy treatment will be prescribed some form of home exercise program. And some people get a bit frustrated by it. They take the view that if they're having treatment, then the treatment should be the sole intervention. But the simple fact is that very often treatment once a week is not sufficient to actually move people forward far enough unless it's supplemented with a home exercise program. So the purpose of the home exercise program is to try to strike a balance between minimizing the one-on-one contacts, which obviously is a bit more economical for you as a patient, and also in terms of trying to speed up the response. Unless you're playing for a professional sports team where you have unlimited resources, then trying to facilitate recovery with some structured home exercise program is usually the best way to get the best recovery in the shortest space of time. Now, that then begs the question, well, what is the most appropriate home exercise? And that really is the key issue. That's really why you seek a professional opinion, because as we've talked about many times before on this channel, if your issues relate to lack of flexibility and movement, then your home exercise programs need to be flexibility related. If your issues relate to lack of muscle strength and control and coordination, then the exercises need to be focused on that particular aspect, and they're completely different kind of exercises. So no two exercises are created the same. They are geared towards achieving different objectives, and really it comes down to what is most specific to what you require. So that's really where the clinician's judgment comes into play. And from your own perspective, any exercise program that you commit to, you need to see changes for the benefit for doing it. Otherwise, it's not really achieving anything. So having established why we use home exercises, then the question often is, well, should I supplement it with other class exercises or other general activity? It really depends on what phase you're in your rehabilitation. But very often there's a transitional phase between going back into sport and going back into a class environment where there's a broad spectrum of exercises and your clinical need, where there may be need to protect an area or introduce controlled loading on the area prior to going back into a general environment. So that's often the kind of category of person who needs to be working on a home exercise regime. Personally, I'm a big fan of them because I think they're very time efficient. So a lot of times you will get a sense that people may be under a lot of pressure time wise with all the usual competing demands. So a 20-minute exercise program 3 times a week can be really, really effective if it's targeting the main areas. I'm not saying that's going to be a complete training program, but it can be very specific and targeted to your needs, and you can certainly achieve a lot in a short space of time. Now, that obviously is dependent on you putting the time aside. But if you're time poor, then the difference between doing a home exercise program and going to a gym, one is 20 minutes and the other is probably going to be 2 hours. So by the time you get there, get changed, do your session and get out again. And depending on the time you go, you may be hanging around waiting for equipment. So a home exercise program, I think, is really time efficient. The question then comes, well, what components should be in it? And if it's stretching, as I said, the therapist needs to have devised a stretching program to target your specific needs. If it's strengthening program, then the key really is working at a level of load that matches your current capacity. And this is something that often slips under the radar, really, where people either try exercises that are too hard for them and either end up hurting themselves or just not being able to produce anything worthwhile. Or on the other end of the scale, they're working on things that are just too easy and they don't really get a training effect. So the key with any strengthening regime is you need to be working at the threshold that produces a training effect. Otherwise, unfortunately, you're wasting your time. So that's something that's dynamic, it's changeable. And, we would see an awful lot of people who are just doing the same exercises week in, week out, and wonder why things aren't changing. Well, basic principle of strengthening exercise is what's called progressive overload. So you need to mix the exercises up, change the body position, change the loading, change the sequence. There are a lot of variables that really a skilled clinician should be able to give you advice on. So, and the other important thing is that if you're just staying static doing the same things, it's not very satisfying in terms of you don't really see any natural progress. So you really need to be structuring regimes so that you can actually see this progress, and it needs to translate into being able to do more functionally. Because if that's what you're doing your rehab program for, well, that's the primary measure, isn't it, really? So your symptoms need to be better, and you need to be able to do more. So they're the very tangible measures. People often say, well, I don't have space to work in or whatever. I mean, essentially, if you've got a bit of floor space the size of your body, which I think most people would have, then you can do body weight exercise. So you don't need an area specifically set up for exercise. Some people like that idea, but if constraints are that they don't have that spare space, then really a bit of space at the side of your bed will allow you to do a vast majority of body weight exercises, from simple partial weight bearing up to really high level loading, depending on where you are on the scale. So lack of space really is rarely a justification, to be honest. The other thing is people say, well, I have nowhere to put equipment. And again, if you're using body weight and some simple tools, which we would frequently use, something called a power band, and there are different grades of power bands. So you need a door handle, or the end of a banisters or a rail, or if you like doing things outside, if you have a fence post or a tree branch or a pole, anything outside, or a hook on a wall where you can attach the band, then you can do strong resistance work using the band. So that's a very, very simple, non-space occupying piece of kit. And the other piece of kit that I really think is very valuable is a TRX Wrap, and whether that's the full-blown TRX or modifications of it, but basically what's known as a suspension trainer. And you can get some of these very reasonably now for 20 to 30 euros. So they're very affordable. And both of those bits of kit fold away and go into a drawer. They don't take any space at all up. They don't need to be permanently set up. They don't need any permanent fixtures. So it really couldn't be simpler. So then the only debate is, okay, do I have the discipline to do home exercise? And that, for some people, is a major sticking point. Some like the commitment of going to a class, having block booked 8 or 10 sessions, having paid money, and obviously that can be the motivating factor, that if they've paid money, then they don't want to renege on attending classes. So that can be the main motivator. But as I've said, much more time consuming in that kind of environment. The other issue, of course, is that very often if you're doing a general class program, the exercises may not be specifically tailored to what you require. So you may still need to be doing specific structured exercise on the side to try to bring you up to speed to be able to go into a general exercise program. So that is another downside, and you can't really expect an instructor who's taking a group of between 10 and 20 people to be able to specifically tailor things to your level or working around your specific injury. So that's an important consideration, as well as the time factor. But again, some people just would say, look, I'm not going to exercise at home, and if that is the way it's going to be, there's no point in setting up home exercise programs and buying equipment if it's not likely to get used. And there's no shortage of exercise bikes and treadmills sitting in people's sheds and garages that never get used. From my point of view, I enjoy exercise, so the discipline end of it isn't a challenge for me. And it's really about trying to identify, what are your short-term goals, if it's getting back to full function, and what are your long-term goals, and what are the most achievable things. But often we find that when people are taken through a structured exercise program and they see practical progressions, it's empowering, and they begin to enjoy it, and they begin to see that it's never too late to start to do controlled exercise. We'll see people up to, I had a patient in last week, 98 years of age. So, it's never too late to try to keep the system stimulated and working, because if you just leave it passively just to function as it will, then really it will obviously deteriorate over time. So I'm a big fan of home exercise, whether it's part of a rehab program or part of a general health program. And a statistic we often say to patients, which is a pretty scary statistic, but the evidence is that after the age of 40, we lose 2% of our muscle mass each year, unless you do something specific to counter that. And very few people who would lose 2% body weight each year after the age of 40. So it'll tell you that the distribution of muscle fibers is changes over time, unless you do things specifically to try to maintain it. And that's a pretty scary statistic, but nonetheless, it's a relevant one. And the message there is that you need to keep working in order to maintain the capacity of the muscles to support you and facilitate normal things of daily living. Otherwise, as you get into your 60s, 70s, then you become a falls risk category if your muscle control has deteriorated. So much better to be aware of these things and put in preventative measures rather than trying to regain lost ground further down the track. So a little bit more background information on home exercise programs and why we use them and the various pros and cons. But I think if you can work on the discipline, I think it's hard to beat a short, intense block of work suited to your particular needs in terms of efficiency. Hope you enjoyed it. I'll see you again on another video. Bye for now.